What are health organizations? Every country is concerned about the health and well-being of its people. For achieving this goal, several kinds of organizations have been working at different levels. We can broadly classify them into three categories on the basis of the level at which they work. A. Local bodies. B. National organizations. C. International organizations. Local bodies. All cities, towns, and even larger villages have some kind of a local body to look after the health and sanitation of their people. These include municipal corporations, municipalities, town area committees, etc. Function of local bodies. Number 1. Sanitation. Removal and proper disposal of garbage, sewage, and other waste. Elimination of breeding places of flies, mosquitoes, etc. Number 2. Supply of safe drinking water. Number 3. Vaccinations. Immunization, that is developing resistance to diseases of the infants and other, to protect them from several infectious diseases such as tetanus, pertussis, that is whooping cough, diphtheria, tuberculosis, poliomyelitis, measles, etc. These programs are intensified whenever there is a risk of an epidemic breaking out. Number 4. Keeping statistical records. Apart from compulsory registration of births and deaths, every other kind of information about the health and diseases of the people in their area is to be regularly maintained. National organizations. In India, several agencies, institutes, and research centers are actively engaged in studying the health problems of the country. These centers are in particular working on the following diseases. Number 1. Malaria. Number 2. Dengue. Number 3. Tuberculosis. Number 4. Leprosy. Number 5. Cholera. Function of national bodies. For each such disease, they undertake a regular survey, identification of the transmitting agent and its breeding places, arranging prophylactic immunization, and any other kind of steps to be taken to fight against the respective diseases. National Institute of Communicable Diseases, which is NICD, it was earlier known as Malaria Institute and is located at Delhi, is seriously engaged in doing research on infectious diseases. An extensive national program under Pulse Polio has been launched to fully eradicate poliomyelitis. International organizations. Red Cross. The Red Cross is a national as well as an international agency. The main function of Red Cross Society is to perform activities which should prevent or remove human sufferings in peacetime as well as at the time of war. It was formally founded in 1864. The emblem of the Red Cross Society is a red-colored cross painted on a white background. People belonging to the Red Cross go to battlefields and take care of wounded soldiers, whether friends or enemies. Activities of Red Cross. Major activities of Red Cross societies are as follows. Number 1. To extend relief and help to the victims of any calamity, flood, fire, famine, earthquakes, etc. Number 2. To procure and supply blood for needy victims of war or other calamities. Number 3. To extend all possible first aid in any accident. Number 4. To educate people in accident prevention. Number 5. To arrange for ambulance service in all emergencies. Number 6. To look after maternal and child welfare centers. Number 7. The Indian Red Cross Society has also been engaged in training midwives. World Health Organization. The World Health Organization, which is WHO, established in 1948, is a specialized agency of the United Nations Organization, which is UNO. Reasons for its formation. Member countries of the UNO focused on the need for creating an international body to look after the health problems of people of the world. This was particularly felt in the field of research on causes and cure of diseases. The combined efforts in this direction were to give better and faster results. The poor in developing countries were to benefit quickly. Structure of World Health Organization. World Health Organization has 6 regional offices in the world, including one in Delhi. Each regional office works for its member countries. Its headquarters are located in Geneva. Member states of World Health Organization are bound by the International Sanitary Regulations to send in all relevant information about the internationally notifiable diseases. Malaria and smallpox are 2 such notifiable diseases. Activities of World Health Organization, WHO. The various activities of World Health Organization are to attain highest possible level of health for all the people, to monitor and give information about the occurrence of epidemic diseases such as malaria, plague, typhus, yellow fever, etc. To promote and support projects for research on diseases. To suggest quarantine measures to prevent spread of diseases. To promote and coordinate biomedical and health services research. To encourage and conduct scientific research, disseminate medical information, and standardize diagnostic procedures through seminars, publications, and other media. To maintain up-to-date statistical health records for most countries, and act as headquarters through which health agencies all over the world can contact each other. to stimulate and support work on prevention and control of epidemic, endemic, and other diseases. One example of endemic disease is the simple goiter due to iodine deficiency. To lay pharmaceutical standards for important drugs, their purity and dose size. To propose conventions, agreements, regulations, and make recommendations about international nomenclature of diseases. To provide information and measures to control deadly diseases like HIV or AIDS.